Welcome back to Health Decode. Today, we will delve into one of the most profound and often overlooked connections in the human body, the secret and powerful link between anxiety and the stomach. Have you ever experienced a gut feeling before an important event, or persistent stomach aches during prolonged stress? These are not mere coincidences. In fact, our mind and digestive system are interconnected through a complex network where emotions and physical sensations interact intimately. So, what is the real secret behind this strange connection? How can worries in the mind cause pain and discomfort in the stomach, and vice versa? Today, Health Decode will unveil this mystery, delving into the biological mechanisms, exploring the diverse manifestations, and providing comprehensive solutions so that you can understand and control this surprising two-way relationship, bringing peace to both your mind and your stomach. Part 1. Decoding the information superhighway between the brain and the stomach, the gut-brain axis. To understand the link between anxiety and the stomach, we need to explore the information superhighway that connects these two organs, the gut-brain axis. This is not just a simple communication line, but a complex system comprising neural, endocrine, and immune pathways, allowing the brain and the digestive system to communicate and influence each other continuously. Autonomic nervous system ANS. The ANS plays a central role in coordinating the involuntary functions of the body, including digestion and the stress response. The ANS consists of two main branches: sympathetic nervous system, often referred to as the fight or flight system. It is highly active during stressful or dangerous situations. When the sympathetic system is activated, it can slow down digestion, reduce gastric secretion, and increase heart rate and blood pressure. Parasympathetic nervous system, often referred to as the rest and digest system. It is highly active during relaxed states. When the parasympathetic system is activated, it promotes digestion, increases gastric secretion, and slows down heart rate. Imbalance. Chronic anxiety can lead to overactivation of the sympathetic system and inhibition of the parasympathetic system, causing digestive problems. Vagus nerve. This is the longest and most important cranial nerve in the parasympathetic nervous system, acting as a direct telephone line between the brain and most internal organs, including the entire digestive system. Approximately 80 to 90% of the nerve fibers in the vagus nerve transmit signals from the gut to the brain, carrying information about the mechanical, chemical, and microbial status of the gut. Only about 10 to 20% of signals travel from the brain to the gut. This highlights the dominant flow of information from the gut to the brain, emphasizing the crucial role of the gut in reporting its condition to the brain, including signals that can affect emotions and anxiety levels. Endocrine system hormones. Stress and anxiety activate the HPA, hypothalamic pituitary adrenal axis, leading to the release of stress hormones such as cortisol and adrenaline. These hormones not only affect mood and energy levels, but can also directly impact the digestive system, altering gut motility, increasing intestinal permeability, and affecting the gut microbiota. Conversely, hormones produced in the gut, such as ghrelin, leptin, serotonin, can also send signals to the brain, influencing feelings of hunger and satiety, and mood. Immune system. The gut contains the majority of the body's immune system. Chronic anxiety and stress can weaken the gut's immune system, increasing the permeability of the intestinal lining and causing inflammatory responses. Conversely, chronic inflammation in the gut can release cytokines, immune signaling molecules, into the bloodstream, affecting the brain and contributing to symptoms of anxiety and depression. Gut microbiota. Trillions of microorganisms residing in the gut from a complex ecosystem that plays a crucial role in digesting food, producing vitamins, regulating the immune system, and even influencing mood through the gut-brain axis. Anxiety and stress can alter the composition and function of the gut microbiota, dysbiosis, leading to an increase in pro-inflammatory bacteria, and a decrease in this imbalance can affect the production of important neurotransmitters such as serotonin and GABA, contributing to increased anxiety levels. Conversely, a healthy gut microbiota can help reduce stress and anxiety. Part 2. SOS signals from the stomach. Common symptoms when anxiety attacks the digestive system. The close connection between anxiety and the stomach can manifest through a range of uncomfortable digestive symptoms, often referred to as functional symptoms, because they have no clear physical cause upon routine medical examination. Abdominal pain and discomfort. This is one of the most common symptoms. The sensation of pain can vary from person to person, ranging from dull aches and cramps to burning sensations or abdominal tightness. Anxiety can increase the sensitivity of the nerves in the digestive tract, making you perceive pain more intensely. Indigestion, dyspepsia, feelings of fullness, bloating, belching, nausea, or feeling full quickly after eating a small amount of food. Anxiety can slow down the digestive process, causing a buildup of gas and food in the stomach. Heartburn and acid reflux. Anxiety can relax the lower esophageal sphincter less, allowing stomach acid to flow back up into the esophagus, causing a burning sensation in the chest. Irritable bowel syndrome (IBS). IBS is a chronic functional gastrointestinal disorder characterized by recurrent abdominal pain, bloating, and changes in bowel habits, constipation, diarrhea, or alternating between the two. Anxiety and stress are considered triggers and factors that worsen IBS symptoms. Nausea and vomiting. In situations of high anxiety or stress, some individuals may experience nausea or even vomiting. Changes in eating habits. Anxiety can lead to loss of appetite or overeating, especially unhealthy foods for emotional relief. These changes can negatively impact the digestive system. Butterflies or tightness in the stomach. Many people describe the feeling of anxiety as a knot or a vague discomfort in the abdominal area. Part 3. The challenging vicious cycle. When the stomach strikes back, causing anxiety. The connection between anxiety and the stomach is not just one way. Stomach problems can also negatively affect mood and anxiety levels, creating a challenging vicious cycle. Physical discomfort causes mental stress. Digestive symptoms such as chronic abdominal pain, persistent bloating, or bowel issues can cause discomfort, fatigue, and irritability, leading to increased levels of stress and anxiety. Impact on quality of life. Stomach problems caused by anxiety or vice versa can seriously affect quality of life, limiting daily activities, causing difficulties at work and in social relationships, thereby increasing feelings of anxiety and helplessness. Anxiety about anxiety. People who frequently experience anxiety-related stomach problems may develop an excessive fear or worrying about their symptoms, creating a spiral of anxiety and digestive issues. Changes in gut microbiota due to digestive problems. Prolonged digestive disorders can alter the composition of the gut microbiota, and as mentioned, this imbalance can affect mood and anxiety levels. Reduce nutrient absorption. Digestive problems can hinder the absorption of essential nutrients, including those necessary for brain function and mood regulation, which can contribute to or worsen anxiety symptoms. Part 4. Risk factors and susceptible individuals. Although anyone can experience the connection between anxiety and the stomach, certain factors can increase the risk or make some individuals more susceptible. History of anxiety or depressive disorders. Individuals who have had or currently have mental health disorders are often more sensitive to the physical symptoms of anxiety, including stomach problems. Chronic stress. Modern life with numerous pressures from work, family, and society can lead to chronic stress, increasing the risk of developing issues related to the gut-brain axis. History of digestive problems. People with a history of digestive conditions, such as IBS or peptic ulcers, may be more susceptible to the impact of anxiety on the digestive system. Sensitive or anxious personalities. Individuals who tend to worry more or have sensitive personalities may be more easily affected by the impact of emotions on the body, including the stomach. Children and adolescents, during periods of development and facing academic and social pressures, children and adolescents can also experience anxiety-related stomach problems. Women, some studies suggest that women may be more susceptible to anxiety-related functional gastrointestinal disorders, possibly due to differences in hormones and the nervous system. Canvas. Part 5. Diagnosis and differentiation. When to seek professional help. Identifying whether stomach symptoms are related to anxiety or caused by another physical condition is crucial. Here are some signs that indicate you should seek help from a medical professional. New or sudden changes in symptoms. If you suddenly experience digestive symptoms you've never had before, or if existing symptoms become significantly worse. Red flag symptoms. These include unexplained weight loss, gastrointestinal bleeding, black stools or red blood in stool, difficulty swallowing, persistent vomiting, or severe abdominal pain that doesn't subside. These may indicate more serious health issues. Symptoms severely impacting quality of life. If stomach problems are interfering with your ability to work, study, perform daily activities, or maintain social relationships. Excessive or uncontrollable anxiety. If you feel overwhelmed by anxiety, unable to control your anxious thoughts, or if anxiety is negatively affecting your life. No improvement despite self-care. If you've tried stress-reducing methods and lifestyle adjustments, but your stomach symptoms haven't improved, doctors may conduct necessary tests to rule out physical causes behind your stomach issues. If no physical causes are found, they may suspect a link with anxiety and recommend appropriate treatments, including psychotherapy or medication if needed. Part 6. A holistic approach. Methods to improve both anxiety and digestive health. Managing the connection between anxiety and stomach issues requires a holistic approach, focusing on reducing anxiety and improving digestive health. Managing anxiety. Cognitive behavioral therapy, CBT, an effective psychotherapy method that helps identify and change negative thoughts and behaviors that contribute to anxiety. Relaxation techniques. Practices like meditation, yoga, deep breathing, and progressive muscle relaxation can reduce stress and anxiety. Regular exercise. Physical activity has been proven to reduce anxiety and improve mood. Ensure sufficient and quality sleep. Lack of sleep can worsen anxiety. Limit caffeine and alcohol. These stimulants may aggravate anxiety symptoms. Seek social support. Share your concerns with family, friends, or join support groups. Medication when necessary. In some cases, doctors may prescribe anti-anxiety medication to help manage symptoms. Improving digestive health. Balanced and healthy diet. Prioritize fresh, whole foods rich in fiber, and limit processed foods, fast food, and sugary drinks. Eat slowly and chew thoroughly. Helps ease the workload on your digestive system. Avoid trigger foods, spicy, greasy foods, and caffeine may worsen stomach symptoms. Stay hydrated. Ensure you drink enough water daily. Supplement with probiotics and prebiotics can help balance gut microbiota. Manage mealtime stress. Avoid eating when stressed or rushed. Practice breathing and relaxation exercises before and after meals. Activates the parasympathetic nervous system to support digestion. Gentle abdominal massage may help relieve bloating and discomfort. Part 7. Listening to your body and seeking balance. The connection between anxiety and the stomach is a clear example of the complexity and interconnectivity of the human body. Learning to listen to the signals your body sends, recognizing the correlation between emotions and physical symptoms, and applying a comprehensive approach to healthcare is essential. Striving for a balance between mind and body, managing stress, and maintaining a healthy lifestyle key to resolving these issues effectively. Recognize early warning signs. Pay attention to small changes in your body and mood. Sometimes, mild stomach symptoms can be early signs of increasing anxiety or vice versa. Early recognition allows for timely intervention, Keep a symptom journal. Tracking your stomach symptoms and anxiety levels can help you identify patterns and specific triggers. Recording your diet, activities, and mood can provide valuable insights for you and your doctor. Practice mindfulness. Being present without judgment helps you become more aware of your emotions and physical sensations, allowing for better management of anxiety and digestive symptoms. Strive for balance in life. Ensure you have adequate time for work, rest, leisure, and social activities. A balanced lifestyle can reduce stress and improve overall health. Be patient and consistent. Improving the mind-gut connection is often a long-term process that requires patience and consistency. Don't get discouraged if results aren't immediate. Part 8. Conclusion. Unlocking the secret to regain inner peace. The hidden connection between anxiety and the stomach is no longer a mystery when we understand the gut-brain axis and the complex interaction between the mind and digestive system. Mental worries can manifest as stomach pain and discomfort and vice versa. Stomach issues can amplify anxiety. However, recognizing this connection is the first essential step for unlocking the secret and regaining peace for both your mind and stomach. By adopting a holistic approach managing anxiety, improving digestive health, and tuning into your body's signals, you can fully take control and improve this condition. Remember, you are not alone on this journey. Don't hesitate to seek support from medical and mental health professionals for the best care and guidance. Taking care of both your mind and stomach is the key to living a healthier and happier life. If you found this information helpful, don't forget to like this video and share it with your friends. And to make sure you don't miss any more valuable health insights from Health Decode, hit the subscribe button now. Thank you for watching.